presenting in just a moment. So, as always, I usually start with some data, so I'm going to start with that. But we are probably at our normal capacity. We have a handful of programs that are closed. We do see some intermittent closures, but not like we have in the past. But there are about 1,950 open with the capacity to serve 163,392 children. 1,138 children and 1,664 staff since last March have tested positive, connected to an early childhood child care program. And then I think on the last call, I had some questions about supplemental funds. Those are the funds that we're paying above and beyond the voucher rate, and that I would get your projection. Based on current data, we look like we will be able to serve or continue supplemental funding through September of this year. So that'll be 2021, September of 2021. If we have more children added, that could change that a little bit, but I think that'll be pretty close to target. It might go a little beyond, but I tried to consider that we could have additional children, both essential and regular low income, that would be added during that time. Of course, some are always adjusted a little bit, but it's just for a short period of time for full-time care. So that's our best projection. We'll continue to update that at each meeting. If we see any trending that changes that, we'll let you know. I do want to point out, if you haven't had a chance, and I'm sure one of the staff can put it in the chat box, but the Child Care Development Block Grant annual plan, or it's actually a 3-year plan, is on the website for public comment. The new rates are in the plan. So when we do utilize all of the supplemental funds, we will be implementing the new rates once the federal government has approved that plan. So I just want to be clear about that. We have public comments through, we just posted it last week, so we'll have 30 days for public comments. We have to submit to the Federal Child Care Office of Child Care, and then they will go through their process of approval. But once the approval is done, and once we have utilized all of the supplemental money, possibly sometime in September, we will switch the rates to the new rates that are again in the plan. So I encourage you to look at that and other parts of the plan so that you can see any changes. And then maybe the big news today. So the pandemic requirements that are in place, which is the mask requirement, the screening, those will now go to guidelines, just like they were last year. If you'll remember, at the beginning, we started with guidelines. And I'm just going to talk you through what that will look like. That means that the child care licensing staff will not be citing programs for any of those items. We have to have guidance in place. That is a federal requirement, but we are at a place where we can pull it down as mandated requirements for our division. It does not prohibit programs locally from implementing. And I have talked to many programs who want to continue to have mask and other parts of it in place. That doesn't prohibit you locally from doing that. It just means that the division is going back to what we did last March through June, and it's just guidance. And this is based on CDC guidance and based on our state guidance from the Department of Health. But we will no longer be requiring the mask for staff that's currently in place. So if you have questions or comments or concerns, please let us know. It doesn't prohibit your local program from doing what you need to do to keep children safe, but we are just letting you know that these will now become guidelines versus mandated requirements from us. Please note that if you have positive cases, you are to report that to the Department of Health. As with any communicable disease, that is a licensing requirement. And they will advise you, as they have throughout this past year, on what to do, whether you need to close a classroom, quarantine, or whatever needs to happen. If you have a cleaning because of a positive case, you will still need to have documentation for that and submit it in the same manner that you've been submitting it. I see a few questions coming through the chat box. I'm going to try to monitor that. You do not have to have written records of screenings. That is all part of the current pandemic requirements. If you want to do that, that is entirely up to you. Let me just point out to you, in the licensing regulations around health, general health, you are required to be monitoring children as they come in. It is a long practice in Head Start programs to do a health screening when children enter the building. So you should be looking at children. And I can tell you, as somebody who worked out in the field, I would be looking for, does a child look like they're not feeling well? You can't always see that, but you can certainly see some things. You know your children best and your families. You all are going to have to do your very best. If you want to continue to do the screenings and record it, that is certainly, you can do that. We will not be requiring that, but it is part of licensing requirements that you are assessing children when they come in and making sure that you do not allow sick children in your program. So hopefully this will help you. I know for some, this is a hardship. I've talked to some programs that are dreading going without the mask mandate. On either side, if there's some pluses and cons. So, but we are, I think, are in a place. I will let you know if we see numbers start to go up or any changes. We will continue to work with our partners at the Department of Health, and we might have to go back in and make changes. But I think we're at this point ready to make these adjustments and just go to guidelines. The guidelines will be posted on the pandemic Division of Child Care's website, in that section that has the pandemic updates, and it will switch to just guidelines. It will no longer say requirements. So you can go to the next slide, Becky. I'm just going to spend a second on the third wave of funding for COVID, the American Rescue Act plan that was passed earlier this year. The division has received the letter of awards. They were 2 separate awards. So for those of you who are wondering about essential workers, the current funding, which is not this funding that I'm getting ready to talk about, should last through July. I did a projection based on current numbers and what is being billed. And let me just remind you guys, and I saw this during the last time, we have programs that did not bill or waiting in 60 days. Please do your billing timely. I don't understand that when I'm hearing from so many of you that you're struggling financially, but we will start reporting to you, hey, you haven't submitted your billing. I'm not saying you need to bill daily, but you should be billing weekly or monthly at a minimum. But we did see, and that makes the projections harder for me because I have to have staff run reports to go, who hasn't billed and has 30-day or 60-day authorization. So please note, you need to do your billing timely. That helps us make these projections more accurately. Masks are optional now. Yes. Nikki Brewer, masks are optional. All of the pandemic requirements are going to guidelines. And I'm not going to repeat any of this, guys. Just know it'll be on the website. And I'm sure there'll be people posting during the call because I want to try to keep us moving as we have a colleague that's going to be presenting in just a moment. So the current funding for your essential worker families will last through July. And then this $178 million will kick in. We have to get appropriation for these new funds. We do not have authority from our legislature, and we have to go get approval. So all of the funds that I'm getting ready to talk to you about are still in the approval processes for state government. But I wanted you to be aware that we have received official notice from the federal government and have our letters of award. So $178 million for essential workers. If you'll remember, we spent about $22 million last year between March, April, and through December 1st of January. And we are now in the funding for the Consolidated Act for COVID relief. And we have 30 million in that bucket. And I think we have about 16 or 17 million remaining, which will carry us through, I project, July. And then this new funding, once we get approval, will kick in. So if you are thinking, can I continue to serve my essential worker families? The answer is yes. You will be able to continue to serve them indefinitely at this point, because 178 million is about 4 or 5 times more than we've had during this whole event. So we should be able to serve them for indefinitely into the future. The funds have to be spent by 2024. So I just wanted to cover that today. The remaining funds, I've just kind of hit some bullets that we've presented to the governor. We are going to be focused on capacity building in areas of the state where there are essential industries that need to have childcare available to them. So think about hospitals, nursing homes, food supply chain. It's just the whole host of the essential worker families that we're serving. Think about the businesses that go with that. And in areas where there's not enough access for infant toddler care or other child care. Infant toddler care will be a mandate. We will not fund programs that do not have an infant toddler component, because when I look at the mapping in the state, we have preschool available in every county. We do not have infant toddler in every county. And that is a must for working families. So that will be for really new. It's called a public-private partnership, and we'll be working with industry to really expand out in rural areas of the state and in other more populated areas where there might be a need for childcare, working with an industry to help establish that. We'll be putting a significant amount of funding to our Teach Scholarship. For those of you who have teachers already participating, many of you may know there's a waiting list. The Teach Scholarship is a national program to help early childhood professionals get their education, either credentialed or a degree in a 2 to 4 year college in this state. And we are going to be putting significant amount of funding from that $286 million to that to help our teachers. These are all part of the federal requirements in terms of improving the quality of care in the state. And I've heard from many who say they cannot find adequate staffing, and we want to make sure that we give the opportunity with one-time funds to do that. We're going to be putting a significant amount of funding to programs to go from level 1 to level 2. Our state has to report out federally on how we are serving the children and how many are in level 1, 2, and 3. And the federal government is really pressing states to move children into higher levels of quality. So we are going to put a significant amount of funding to help those of you who are in level 1 achieve level 2. That's looking at data that we have and looking at the needs that you may have to get there. So it could be some things that you need in your classrooms, or maybe playground, but just some enhancements and things that you need to help achieve that, maybe additional training. But we're going to be doing that to help those of you at level 1 get to level 2. That will be our first priority. And then certainly we want to help level 2 programs get to level 3 and higher. We are certainly focused on infant toddler expansion, as I mentioned. We're also looking at rural areas of the state. So if there's a need in a rural area, just looking at deserts where there might not be existing childcare, and that will give existing programs an opportunity if they want to expand. And then we will be reserving the portion that the feds allow in this funding for administrative costs. Many of you may have known, and I've said it many times, we have not retained a penny here at the Division of Child Care for the CARES Act and for the current CURSA funding that we're using. But I'm going to tell you, with $500 million, my team is not going to be able to do this without support. So our agency has directed me that we will reserve the full amount for administrative needs. That's a very measly 5%, but that will be a significant amount for us. But to hire adequate staffing to help get those essential workers qualified and approved, and any of the other things for licensing that we're going to need in order to implement this and do it in a way that the feds expect us to with accountability. We'll also be doing some IT enhancements. We're really looking at a real-time childcare search so that you as providers would have an opportunity to advertise when you have openings, and parents could see that in real time, that you have an opening either for a voucher or for a paying child. So we're excited about some of these. That's about as much detail as I have. Again, we have to get appropriation approval, but we are working through those processes. We are currently spending down the funding that we have. So this isn't a major issue for us right now, as we have 119 million and we've spent about 20 to 30 million of it. So we still have a lot of money from the previous relief package that we're using, but we'll have this funding in the American Rescue Act plan through 2024. And this is the list of things. I do want to point out, just so folks know, when I'm talking about expansion and opportunities, it is for all licensed childcare centers, family childcare. There are places where family childcare will really be able to access and be the best fit in some communities, especially maybe in some of the rural areas or smaller communities where that is the best fit for families and the best fit for needs, because there aren't enough children in some communities to have a large center. There wouldn't be enough capacity and it wouldn't make any sense financially. So I just want to make sure everyone knows this is really a very broad, high level, but it includes all programs. We really will be looking for infant toddler care. So I'm going to move on to the next slide. I know people are putting notes in the chat box. The last thing I'm going to mention is the legislature, as many of you know, has recessed, which is a little bit different. So they're not ending. They're going to be coming back later to do some redistricting and things this fall, or possibly before at their call. But there was one act, Act 828, that is a law now. It has become a law. And we are working with our team. I'm not sure that it will be promulgated in our rules and regs and licensure. We're working with our legal team, but because it's a law, you will have to follow it. We will provide you with the timelines and everything for that. It's not in place today, so don't worry about it, but I encourage you to go look at it. It basically says if you are an owner, manager, director, and you are married to a sex offender, that you have to notify your families. That is not a piece of legislation that our division sponsored, but it is a piece of legislation that passed. And so we will be working with you from the licensing side. It is nothing that you have to worry about today. We will not be citing you for it. You don't have to worry about it. There's a process in place, and it has to be follow those timelines. And really, it has to be in place by next June officially, but we will be working with you to notify you on our licensing team. But wanted you to be aware of that particular act. That was really the only thing significantly impacting childcare and early childhood education from our division. And I think that's it for me. I'm going to toss it over. I think I'll start monitoring the chat box, and I'm going to toss it to Ashlyn. We wanted to spend a few minutes. I know we've got family support up, and somebody's going to be talking about that, but I wanted to toss it to Ashlyn and talk about behavior health for just a moment.
Good morning, you all. Okay, so we are seeing an uptake in numbers in our behavior health. We're definitely here, you guys, if you need any help or any assistance with children that might be challenging or you might need help with. But we thought what we would do is take just a few minutes to reorient ourselves. I'm not going to share any information that's new to you. You guys know this. But we thought that we would just kind of put it back on the forefront of our minds, and that is this. A lot of the children that we are seeing coming back to our child care centers and back to our family homes now have been at home, or they've been in other settings while their parents have been off or maybe working remote themselves. And so we just need to be mindful, much like adults are, or at least let me speak for myself, like I am. When I am in an unstructured setting, like at my home, working from home, I can drink a Diet Coke. I could, get up and down and move around my home while I'm working virtually, and might do some behaviors that I wouldn't necessarily do if I was here in the office or on a Zoom call or a Teams call. And children are the same, you guys. And so if you're struggling with some children that have been away from your facility for a while, we just need to be mindful that when they're coming back into a more structured setting where there's rules and there's expectations placed on them, that it'll be um, pretty expected for there to be a little bit of give and take in that behavior until the children can settle back into what is expected of them. So definitely, if you need to call the behavior health hotline or send in a reference or a referral form, do it. But just remember, there could be a little lag time in getting adjusted back. And so if you guys can just share that with your staff members at your facilities, that would be great, a great help. I'll be glad to take any questions on that. If you have some, just put them down in the chat box. Or if you just want to call me and I can talk you through maybe what would be anticipated behavior or what would be out of the norm, then I can definitely do that for you as well. So I'll stick my telephone number in the chat box for you, but I appreciate you guys just being a little understanding and knowing and expecting that behaviors might be a little bit off right now until we can get everybody settled back in. Appreciate you guys. Thanks, Tanya.
Thank you, Ashlyn. I put a few notes in the chat box regarding some of the questions you all have asked. I do want to highlight a note from my dear friend and colleague, Sandra Withers. Please consider the COVID vaccine if you have not already. We are not mandating that, but in light of the changes that are happening, and I will tell you guys, I have had both of my shots, and most of my staff have. You know, and I went and got mine as soon as I heard that we were going to have all of our team back in this office on May 17th. I was kind of waiting behind the childcare world, trying to let you all go first, as you guys were first up in that round, or maybe second in the round. But I had some of my staff going pretty early on that are coming out to monitor, and I was waiting. But once that announcement was made, I went and got mine. I feel very strongly about that. I think it will keep you safe. For those of you who have not lost loved ones, good for you. For those of us that have, it is very painful. It is very painful. It's been very painful to watch some of my staff and colleagues have people get sick and also die from this illness, from this horrible disease. So just want to put that plug in for my dear friend, Sandra. I couldn't agree more, Sandra. You know, what happens in your facility now, you all, and I respect you all, and I'm already seeing in the chat box, some people going, you know, I'm not going to do the mask, but I'm certainly going to keep the screenings. I've heard from some colleagues that said I'm going to keep the mask. So that is entirely up to you all, but I really appreciate it. And I have complete trust and faith that you all will do the right things as we move forward to keep yourselves safe and the children. The children are probably generally going to do better than the adults, as we have seen from this illness. But just be aware, you're, you know, if you don't have some things in place, you could risk, and you've seen it, staff getting sick. So just be aware of that. It's your choice, but you've got to pay attention to that, or you will not have staff to run your programs. So I think we're going over to family support. So let me let them give some updates, and I'll keep monitoring the chat box. Tom?
There we go. Well, two things that we really have is the ABC summer. The approval letters are going out today. In those letters, there'll be some definite timelines that need to be met as far as training and applications. And then our quarterly maintenance payments are also going to be sent out this week as well. So we've got those two main things that are going on with family support.
Okay, thanks, Tom. And for those of you who don't know, Tom has stepped in as interim. Jaisha Quarles on our team had a baby last year and had an opportunity to work from home. She took a new job. So Tom, who used to do the childcare program when I first came here 17 years ago, has been doing nutrition but stepped over, and we really appreciate you and your leadership, Tom, for doing that. So thanks for the updates today. I just want to, for those programs that are currently licensed, I think, you know, Rita specifically, you had asked me a question. I want to make sure that folks know this. If those of you who have a current license want to expand, we're not today. If you wanted to go ahead and do that expansion, you can serve whatever population you're serving. What we're talking about is if you're going to be doing expansion in the future with this funding, in order to access these funds, there is a component for infant toddler care. We really have to pay attention to that in our state. And so we're going to be looking at, we have all this data and geographical information, and we're going to be looking at community by community. So if in your community, and I can tell you right now, there is no community like this. So let me just put this on the table. There is no community in this state serving all the infants and toddlers. But if they were, then that would not be an issue for us. But because the mapping is clear from our licensing data, there is just an enormous amount of gap for infants and toddlers. So just be aware of that. We are very focused on that. We are working in partnership with our colleagues at the Department of Ed, who is administering state-funded pre-K, and with our colleagues at Head Start, who also serve a lot of preschool age children. So just know those are our two partners, and they really have the bulk of preschool children in the state. We do not any longer in the Division of Child Care. So we're going to keep working with them. And if that's an area you're interested in, you can certainly reach out to those colleagues for information about funding in their programs, but we're really heavily focused on infant toddler. We will let you do preschool and school age, but you have to have the infant toddler. And we will be looking at data for that. So I'm going to go on down. I think we're ready to shift over to my friend and colleague at the Department of Ed, Lori Bridges. So Lori, I think you have hosting privileges, so we're going to let you take it away to talk about literacy.
Hey, thank you, Tanya, and your team over at DHS. Those of you that are not aware, Arkansas Better Chance, our state-funded pre-K, did transition to the Department of Education a little over a year ago. Even though we are located at the Department of Education, we still have a strong partnership with the Division of Child Care and Early Childhood Education at DHS, and with our partners with all the pre-K Head Start, I'm sorry, with Head Start. So one of the things that I wanted to share with you, first of all, for ABC programs, the guidelines, the COVID guidelines would, for licensing, we will follow those. So like Tanya said, those requirements have gone to guidance even for ABC programs. One of the reasons why we had to continue to follow that was for licensing, and our ABC programs do take federal funding. So that was why it was important for us to continue with that guidance from DHS. But today I'm here to share an opportunity for our pre-K4 programs across the state. If you are familiar with RISE, Arkansas Department of Education a couple of years ago started a RISE initiative with a reading initiative for student excellence focused for kindergarten through 12th grade. Well, the Arkansas Department of Education is proud to announce the launch of pre-K RISE. And with this implementation scheduled to begin in July of 2021, so this July, through the pre-K RISE, ADE is committed to expanding its focus on early childhood education by providing a curriculum, a foundational literacy curriculum for center-based programs that are serving 4-year-olds in that year prior to kindergarten. We're also going to be hiring some support for educational assistance in our pre-K programs. We'll have regional technical assistance support, and we will provide professional development for early childhood educators that is grounded in the science of reading. The intent is to increase teacher knowledge and skills and developmentally appropriate practices for early literacy instruction in order to impact lifelong learning outcomes for our young children. So I'm going to share my screen, and today I'm going to give a brief overview. Those of you that are ABC programs have heard probably a lengthier presentation on the pre-K RISE initiative. Today, because we want AD is committed to equity and making sure that the curriculum and the professional development is not based on your funding source. So if you are a licensed early childhood education provider and you serve those children that year before kindergarten, then you have the option to register for the pre-K RISE initiative. And I'm going to be sharing a brief presentation. If I can share. Okay, so do you see the infographic flyer? Tanya, yes, okay. All right, so today I'm just going to go over what the initiative, the pre-K RISE initiative is. We have rolled out phase 1. And if this is something that you and your program would be interested in, I am going to share a form in the chat, and you can complete the form, and I will send you a Zoom email link to a informational presentation for Thursday May 6th at 12:30. So I will be adding those in the chat. But first of all, the Pre-K Rise Initiative, we've got 2 phases. Phase 1 is a foundational literacy curriculum, which is not to take the place of your comprehensive curriculum, but it is a supplement, a 15-minute-a-day supplement curriculum developed by Really Great Reading, and it's designed to be implemented the year prior to kindergarten. The lessons provide playful, developmentally appropriate, targeted instruction in oral language development, concepts of print, instructional vocabulary, alphabet knowledge, phonological awareness, and phonemic awareness. So all of those components are in our early childhood, early learning standards, our Arkansas early learning standards. And most curriculums embed those skills and concepts, but this is a direct 15-minute a day, which there's flexibility, and we'll go into that more if you're interested in our presentation on Thursday. But the lessons, like I said, are designed to be 15 to 20 minutes a day. The lessons can be broken down into smaller chunks where you can do 5 minutes, 3 different times throughout the day, depending on the responsiveness of your 4-year-old pre-K children. Launchpad includes some training. There are asynchronous trainings that would be required prior to the implementation, and those would begin in July, and you would have July through September to complete the trainings with the targeted date of September for implementation. The Launchpad curriculum is a 28-unit program, which is 28 weeks, and so in order to complete that, we are recommending beginning that in September through mid-April. So there's some flexibility in that as well. But when programs commit to implementing Launchpad, the early learning, the foundational literacy curriculum, they'll receive the technology license that includes the asynchronous professional development and the teacher manuals. There are 3 teacher manuals that are very scripted for teachers. So there's not a lot of requirement in this area to be able to implement. And there will be materials for the children to use and technical assistance from our regional early childhood specialist. Participating programs must complete all the trainings and implement the curriculum frequently and faithfully. So phase 1 is the early foundational curriculum, literacy curriculum. Phase 2 would be the science of reading professional development. We are using letters for early childhood educators. This course will empower teachers to understand the what, why, and how of early literacy instruction based on the most current scientific research. This course will define early literacy and language and the processes involved and the developmental sequences by which these skills are developed. A lot of brain research is out there the last few years that really show us how we can have an impact on children prior to kindergarten with the phonological and sounds of our language. But there will be coaching and technical assistance during the implementation of these professional developments. And I think I might have skipped the most important part, but Arkansas Department of Education is providing the curriculum and the professional development at no charge to our licensed pre-K4 providers. And again, the timeline for the implementation of the foundational literacy curriculum called Launchpad would be, the training would take place between July and September. And again, that's asynchronous training, and we are asking coordinators and directors to facilitate that. But the training is provided. We would just need facilitation by the directors and the coordinators. And then with the implementation of the letters early childhood, that would not begin until January 2022. So again, those are phase 1 and phase 2. We are looking at the approved curriculum list for our Arkansas Better Chance, our state-funded pre-K programs. We are going to be looking at revisions and updating that list beginning June 2022. So I know that was a lot of information. We do have, like I said, I'm going to share the interest form. So when I'll put this in the chat, but when you click on it, we are just asking you to submit your information so we can provide a Zoom invite for you for a follow-up presentation that'll get more in the details of the implementation of the Pre-K Rise initiative. But that Zoom will be this Thursday, May 6th at 12:30. Again, if you will not be able to make that Zoom, if you would still complete the interest form, we'll have your email address and we can send out a recording and any of the resources provided during that Zoom to help you and your program determine if this is an initiative that you would like to be a part of. Again, it is optional, even for our state-funded pre-K programs, but we at the Department of Education felt that having a consistent, aligned, focused curriculum piece for those science of reading components to help children be more prepared for kindergarten and the curriculum that they will be introduced to in kindergarten. We felt that this would be an equitable, high quality curriculum with professional development that is focused in the curriculum. So again, this will give you time to determine if this is something that you want your program to be a part of. It's not a now or never. It is going to be the implementation will be over several years. So again, we're telling our programs if they are already, have a focused implementation focus for something this upcoming year and it's just not a great time for them, we completely understand that. And you could catch this on the next round. Right now, we are working on some priority groups. And as people register or complete the commitment form, we are looking at things like number one, do you serve in a 4-year-old early childhood educational setting? Are you participating in Better Beginnings? And if so, what is your quality rating? Again, those things are not going to keep you from being a participant in this initiative, but it's helping us develop some priority groups. We do have a certain number of licensed through Launchpad and Letters Early Childhood. But again, we feel that we've got plenty to make sure that everyone that is interested and wants to be a part of this can participate. So I am going to look at the chat just a minute, and now Alicia Atwood is our Pre-K Rise specialist here at the Department of Education, and she is working with us, and you will see her name on some of the flyers, so you can contact me directly or Alicia Atwood. If you are not sure and don't have those contacts, you can always contact your ABC specialist and they can get that information to us. So let me take just a minute to put some information in the chat for you. The first thing I'm going to put is the link for the interest form. So if you would be interested in participating in.
As Lori does that, she's going to probably be monitoring. I know there was another question, Lori, about, you mentioned centers and someone asked about homes.
Right now, our priority groups are focused on center-based programs. That's not to say that we will not provide some of the professional development to our family home providers and our home visiting providers. But as far as the curriculum Launchpad implementation, our priority groups right now are for center-based educational programs that serve children a year prior to kindergarten. I'm also going to share the one-page piece that I used today, so you can have that to refer to.
I will, the link, I think Jill put it in the chat box and it does work regarding the flyer. So thank you so much for doing that. If those of you who are on are interested in that flyer, Jill actually typed the link in just for the information that Lori shared, that one-page flyer. So it is available and it is working. I think that's probably it. Lori, thank you so much. And Lori's on our calls, but you can certainly reach out to her and her colleague, Alicia Atwood, if you have questions about the pre-K rise. But we do appreciate you for being on and encourage programs to take a look at that, especially if you're serving preschool age children.
Thank you for having me.
You bet. So the information about the American Rescue Plan Act will be on the website as always, the information that we have. I'm sure you can Google it and get information off the web. There's a lot of information about that act. It is a huge act. I can't remember the dollar amount on it, several $trillion maybe. But anyway, there's a lot of other programs, including funding at the Department of Ed, that will be in that for K-12, as well as many, many other entities in the state and community. So I just want to point that out. It's not just about childcare and early childhood, but we're very excited about it. And we will post the slides that I had. Just for those of you who are interested, I've had several of you said you're interested. Please know the information today is very high level. There's not a lot of detail because we just got the notice of award last week. And we don't even have authority yet to even access those dollars. We have to get permission and we'll have to go through a whole process for that. So we will be announcing that on these calls. So in 2 weeks, we may have some additional information, but I don't expect that we'll have any approvals for spending until July because of where we are in this fiscal year and the fact that we're still spending $119 million. I don't really see any reason to ask the legislature for more money right now. They probably would question that. So we probably will be going for permission outside of any emergency situation for that to occur in July. And we will start pushing out information about how to access it and announcing it on the call. So watch the website, but I think it will be July and beyond for any access to funding. And it will probably be through some sort of competitive grant process. But those are things that procurement that are even outside of my leadership ability to make decisions about. So there's a lot of approvals that have to be in place, but we will have processes. We will be announcing to you. We will be posting on the website. We will have a place for the American Rescue Plan Act information that will be in our COVID space as we get more details and more approvals. So I just want you to know, I'm real excited. I noticed there are a few comments about infant toddler ratios and related to family child care. We will certainly take a look at that. I do want to point out that we will be working with federal and national standards around ratios. So there are some very specific standards about that. But I certainly hear some folks saying we need to take a look at that, and we will do that. If you're only going to be serving infants and toddlers, that might be different. But if you're going to be mixing age groups, that probably is going to have to remain that way for safety reasons. But we'll take a look at that and certainly welcome your input. But the quality stuff and the way the feds are looking at this and the way they're looking at this funding is really for states. This is one-time money. So it's going to be gone at some point. So we have to think about things that we can put into place. We can't serve children with it, for example. We could help you with one-time cost of putting things in your classroom, with scholarships and opportunities for your staff to get better educated in early childhood. But we can't pay for childcare, for example, because it's going to be gone. And then you're going to be sitting there without funding. So there are certain things we can and can't do. But we'll take a look at some of the comments that you put in and welcome your input and appreciate your input. Lindsay Sanders has a question about soft items in the classrooms. I'm seeing a shaking head from Ashland. I mean, today you are going back to your regular minimum licensing standards regulation book. So it's on the website. There is nothing in place other than pandemic guidelines for your facility to use, because we are still very much in a pandemic. And by the way, the $500 million in the American Rescue Plan Act for us is attached to the pandemic. It's not like it's separate. They're giving it to us as a result of the pandemic. So we just need to be aware of that. There is a connection. So we don't want to act like we're not in the pandemic. And there's still a national or federal emergency declared. We're just saying we respect and have heard from you and where we are as a state. Numbers are down, that you all can make the decisions today. We're putting that back in your hands to make the decisions. We will work with you if you need assistance, but you will need to continue to document things and share that. If you're going to be getting funding, you may need information. And if you're not clear about that, please reach out to my staff. For the cleaning, for example, you have to have a positive case in order to access that funding. So all of the things that we've been doing, we're just saying the pandemic requirements are now guidelines. So you all can make decisions about what parts of it you want to keep, or if you just want to follow minimum licensing standards, because everything in our standards takes care of a lot of this hand washing and sanitizer. If you're following our normal regulations, you're taking care of a lot of this. The mask is one of the issues, and Sandra is putting out her comments from the health side, and I so appreciate her. So appreciate her, because if you don't have all your staff vaccinated, children can continue to spread this and it could have an impact. So just be aware the decisions that you make can have an impact on the operations of your program. But we're letting you make those decisions, and we'll be happy to work with you if you need our help. But I have heard from, I cannot tell you how many parents have reached out to me and said they could not access their program. And I said, that is not a requirement of ours. That may be a local requirement of the program, but we don't have anything in the regulations that say parents cannot go into the facility. In fact, if you read the requirements, it says that parents can in fact go in. Please look at that carefully. The list of people who can go into the facility does include parents. What it does say is that you need to screen them before they go in the facility. You need to make sure they're healthy so that you don't have a person with COVID. So just know that. I do want to just end. I think we've answered most of the questions today, and just so appreciate my colleagues who've helped and put things in the chat box, and colleagues at the Department of Ed for the work that they're doing. I just want to say thank you. We have been through an incredible journey over the past 15 months. And for those who've made it, it feels pretty good to be in this place today saying we can start to lift some things. And maybe if everyone gets their vaccines, they can start to live a little bit more normal as to what we did, 2 years ago. But just be aware, pay attention. We will be watching numbers, we will be monitoring, and we will update you if we see any need to make any changes. Report any positive cases to the Department of Health. Reach out to us if you need assistance with anything. I did see a comment from Amy. Yes, Amy, you may require, let me first of all say, in the agency, we are required to wear a mask. That is not changing for my agency. When you walk in this building, you must wear a mask or you will not be able to come in. You must wear it when you walk out of your office, out of your cubicle. That will continue. My licensing staff will be wearing a mask when they come to visit your facility to keep them safe. So yes, my team will be continuing to wear masks when they come out to monitor, both on the nutrition and the licensing side. Any of the staff from the division will continue to wear a mask. So to answer that question, but if you want to keep it for your facility, you may keep that. That is certainly up to you, but the staff will be wearing that. And I will just say this on the call because I know I get pretty intense sometimes. If any of my staff show up without a mask, please report that in directly to me or Ashlyn Abney or Tom Shepard. We would want to know that. We want to keep you all safe, but we want to keep our staff safe. So they will continue to do that. And if they're not, we need to know that because it is an agency directive for us. I did see a note from Cindy at the Helen Walton Center. Cindy, thank you. She's making a comment about RSV cases. Apparently they were down because people were wearing masks. I would say there were probably a lot of illnesses over the past year that were protected a little more than normal because we were all wearing masks. So, but thank you for noticing that. And I see Randy Old has also pointed out that, yeah, much less illness. The mask probably helped. The hand washing and sanitation, you guys do well every day, but the mask probably did prevent things that we would normally see. So again, for those of you who want to keep things in place, and I understand the reason for not letting people in your facility, it was practical just to have outside screening. We know that, but it was also painful to hear someone say, it is your fault that I can't go into my child's classroom. It's like, no, we did not make that mandate. That is a local decision. So please know that, guys, we want to partner with you, but I cannot take responsibility for something because all I'm going to do is send them the pandemic requirement and they're going to read it and go, oh, well, you didn't have that as a requirement. But I do understand the practicality. It was much easier. I do get that, but please tell parents that. Please say that to them. Hey, this is our policy and here's why. This is practical. Please don't blame the agency for things. We are partners and it just doesn't bode well. And then I'm going to have to answer for it. And when I say, well, we don't make that, they're looking like, oh, then they're going to be coming back at you. Okay. And I don't want to do that. I don't want to do that to you guys. You guys work too hard. So just know that. You have the right to require the mask. You have the right to require a vaccine. You have the right to do some things that I can't do, but just those are your choices. Yeah, Rita Neve, yes, I thought about the flu. Rita's saying it was non-existent almost. So yes, I feel like the mask probably helped in a lot of ways. Not recommending that we have to wear a mask for everyone. I'm just saying, yeah, it probably did cut down on a lot of things. And I see my friend and colleague Tamara Rowland representing Family Child Care saying she's going to be wearing masks and she's fully vaccinated. So I appreciate all of you for all that. The mask mandate is no longer in place, gang. It is just a guideline. We are required through the funding to have the guidelines in place, and we do reserve the right if we see any changes to reenact anything to keep children safe. But at this point, I think we're in a good place. You do not have to, if you, let me just talk about the parent thing, because I just see a note, you know, if, and I apologize, if you are not allowing parents in, that is your choice. Please let your parents know that is your choice. I will make sure, and Kelly's monitoring, our staff will not tell you that you cannot have that policy. That is your choice. Just make sure we're all clear and the parents are clear that is your policy. But that is something that you can do. If you want to still screen outside and keep parents from coming in to protect children, just make sure that you're notifying the parents of that. But I'll make sure that the licensing staff know that that is the right of the program to reserve to do that. You can do that. Just don't blame it on DHS, please. Okay, gang, I think that's it. We're getting close to the top of the hour. I do want to say thank you again. We have survived a crazy, crazy time, and we still have some ahead of us. So let's all just, you know, be vigilant, stay safe, get vaccinated. We are processing maintenance payments this week. So just know that the quarterly maintenance payments are being processed. The staff are keying today through Thursday. They hope to have them finished on Thursday. So you should see your, that's your funding that's coming in quarterly based on your license capacity quality. And then they'll start the supplemental payment right after that for the previous month. So trying to get all that processed. But thank you all for everything you're doing. Keep trying to improve the quality. That is going to become more and more important. And that is not a Tanya, although I am 100% behind it. It is a federal requirement. We have to report in that we're improving the quality, and we want that for children. So everyone stay safe, take care, and we'll see you in 2 weeks. And we're going to keep the call. Yes, Lori, I see you.
Real quick, I wanted to make a clarifying statement because I did, I think there was some misconception on the family childcare homes. If you are a private family childcare home and you provide early childhood education to those 4-year-olds prior to kindergarten, you would qualify and be in that priority group. So I apologize for, you know, not putting that out, without some misunderstanding, but I did restate that phase 1 launchpad curriculum of the pre-K Rise is for center-based early childhood programs, family child care homes, private programs, school-based programs. So like I said, if you provide that to children in that year before kindergarten, you would be eligible for that from the Arkansas Department of Education. So.
All right, and I do see some notes about the pandemic requirements. Please know you guys are getting the announcement fresh off the press. So we haven't even updated probably the website. We will be doing that to guidelines. So don't panic when you see requirement. We're just letting you know before we even make the change so that you can prepare and do what you need to do at your facility. But it will be probably changed before the day is over, but keep monitoring that. But it will go from pandemic requirement to pandemic guideline. And that's really basically the only change you should see. It'll still be under the COVID information. So thanks again, everybody. Stay safe, and we'll see you in 2 weeks.